Welcome to First Aid Basics. This course covers the symptoms and basic first aid procedures for common medical emergencies. This course does not result in a first aid or CPR certificate. Medical emergencies are a sudden onset of a medical condition that, without immediate attention, could put the person's health in jeopardy. The following conditions constitute as a medical emergency and should be evaluated further. Bleeding that will not stop, difficulty breathing, shortness of breath, or abnormal breathing, change in mental status, such as unusual behavior and confusion, chest pain, choking even if the object is expelled, coughing or vomiting blood, loss of consciousness, suspected head or spine injury, sudden and severe pain, swallowing a poisonous substance, and upper abdominal pain or pressure. In other words, any severe change in the body that might put health at risk warrants immediate medical attention. Call 911 if the person's condition is life-threatening or could become life-threatening on the way to the hospital, if moving them could cause further injury, or if you are unsure. Symptoms of allergic reactions include breathing difficulty and wheezing, swelling or tightness in the throat or chest, nausea and vomiting, and changing levels of responsiveness. Use an EpiPen if the victim has one. For minor reactions, use an over-the-counter antihistamine. Call 911 if the reaction is severe or if medical attention is more than 20 minutes away. Be prepared to give CPR. To treat a bleeding wound, put on exam gloves and apply direct pressure over a sterile dressing. Do not remove gauze to check if the bleeding has stopped, as this removes the clot that is forming. If blood seeps through the gauze, apply additional gauze on top. Use a pressure bandage and wrap towards the body. Call 911 in the event of severe bleeding and use a hemostatic dressing. For most muscle and joint injuries, the RICE acronym can be applied. R is for rest the injured area. Support it and do not move unless necessary. I is for ice the injury to reduce swelling and pain. Use an ice water mix with a barrier, like a cloth, between the skin and the ice. Leave it on for 15 to 20 minutes for every 2 to 3 hours during the first 24 to 48 hours after the injury. C is for compression with an elastic roller bandage that can be rolled over the ice water bag. And E is for elevate the injured extremity. Persistent chest pain or discomfort, pain in the neck, jaw, shoulder, or arms, shortness of breath, dizziness and lightheadedness, anxiety, pale skin, and sweating are all symptoms of a possible heart attack. Indigestion and nausea are more common in women. Call 911 immediately. Help the victim rest and loosen constricting clothing. Have them chew 1 adult aspirin or 3 to 4 child dose aspirin. Do not give them anything to eat or drink, including water with the aspirin. Monitor their breathing and be ready to give CPR. If someone is choking, ask them if you can help and have someone call 911. The American Red Cross recommends the 5 and 5 technique, 5 back blows, then 5 abdominal thrusts. For back blows, stand to the side of the person. Have them bend forward slightly at the waist. Support their chest with your arm. Give 5 blows between the shoulder blades with the heel of one hand. If the object is not expelled, attempt using abdominal thrusts. Stand behind the victim with one leg slightly between the victim's legs. Reach around and locate their navel with a finger from one hand. With the other hand, make a fist and place it thumb side against the victim's abdomen just above the navel. Grasp your fist with the other hand and thrust inward and upward until the object is expelled or the victim becomes unresponsive. If the victim becomes unresponsive, begin CPR immediately, but check the airway before giving rescue breaths. Diabetes is a condition in which the body does not properly process sugar. Low blood sugar can cause sudden dizziness and shakiness, mood changes and confusion, headaches, pale skin, and eventual unresponsiveness. Give the victim glucose tablets or some other source of sugar, such as candy, crackers, and juice. Give more sugar if the victim does not improve after 15 minutes. Symptoms of high blood sugar include frequent urination, drowsiness, dry mouth, thirst, fruity breath, and nausea and vomiting. Give the victim water and call 911. If you aren't sure whether the victim has high or low blood sugar, giving sugar won't cause additional harm. If you see someone having a seizure, do not try to stop their movement or restrain them in any way. Move large objects that could injure the person and provide padding or a jacket under their head. Call 911 if the seizure lasts more than 5 minutes. The person is not known to have epilepsy. If the person recovers slowly, has trouble breathing, or another seizure. If they are pregnant, wearing a medical ID bracelet, or injured. A victim experiencing a stroke may have sudden numbness or weakness in their face, arm, or leg on one side. Use the FAST system to identify symptoms of a stroke. F is for the face. There may be drooling, and one side of the face might droop some. A is for arm weakness. If you ask them to raise their arms, one may drift downward. S is for speech difficulty. Ask them to say their name. Their speech may be slurred. T is for time to call 911. Note the time the symptoms first began. Lay the victim down with their head and shoulders slightly raised. Turn their head to allow vomit or drool to drain. Loosen constricting clothing, and be prepared to give CPR. Eye injuries are common, from chemical splashes to flying debris. For chemical splashes, flush the eyes for at least 15 minutes with water, and then close the eyes and cover them with a clean cloth. Get immediate medical attention. For solids, such as particles, dusts, and powders, flush with water until the particle comes out. If it won't come out, cover the eye and seek medical attention. Don't let the victim rub the eye. For a blow to the eye, apply cold compresses for 15 minutes to reduce pain and swelling. Get medical attention. For cuts near the eye, bandage loosely and get medical attention. Don't let the victim rub the eye. For objects that penetrate the eye, do not try to remove, move, or put any pressure on the object. Immobilize it by placing a paper cup or soft, bulky dressings around it secured with tape. Bandage the other eye so that the victim will keep the injured eye still. Get immediate medical attention. Burns are another common workplace hazard. You can be burned by hot surfaces, hot materials, or by the properties of certain materials. First aid for burns depends on the degree of the burn. First-degree burns are the least severe. They only affect the top layer of skin, which becomes reddened and painful. Treat first-degree burns by running under cool water. Second-degree burns are more serious and include blistering in addition to reddened skin and pain. Treat with cold, running water for relief of pain. Then cover the burned area with a moist, sterile dressing. Don't break blisters on second-degree burns. Third-degree burns are the most serious and can even be life-threatening. With third-degree burns, the skin is destroyed. You see charring and deep tissue damage. You may even see exposed bones. For third-degree burns, call 911 immediately and keep the victim comfortable until help arrives. Always get immediate medical attention for burns that are severe and those that cover large areas of the body. The recovery position is used when a victim is unresponsive but breathing, and there are no other life-threatening injuries. The purpose of the recovery position is to keep the airway open and allows vomit and fluids to drain. To put someone in the recovery position, kneel next to them, preferably on their left side. Put the arm closest to you at a right angle. Drape the furthest arm across the chest and place their hand between their shoulder and jaw. Grab their shoulder, hip, knee, or pant leg. Roll the victim towards you. Bend their knee to prevent them from rolling onto their back, and open their mouth to allow fluids to drain. CPR, also called basic life support, stands for cardio, or the heart, pulmonary, the lungs, and resuscitation, which means to bring back. It is a life-saving skill for people suffering from cardiac arrest, which is when a person's heart stops beating. It involves a combination of chest compressions to manually maintain blood flow and rescue breaths to provide oxygen to the lungs. Before rushing to a person's aid, ensure there is no danger to yourself, such as heavy traffic, a fire, electrical hazards, or chemical fumes in the air. When you reach the person, tap and shout to try and get their attention. Look for any signs of movement, such as blinking, mumbling or trying to speak, and moving fingers and feet. Watch the chest for 5 to 10 seconds. If the chest does not rise, the victim is not breathing and needs CPR. An unresponsive person is always a 911 emergency. If you are by yourself, you will have to call 911 first. If there are others around, tell someone to call 911 while you begin CPR. If there is an AED nearby, get it quickly or ask someone else to get it for you. An AED is an automated external defibrillator that delivers an electric shock through the chest to the heart. AEDs are simple to use and effective. Place the AED next to the victim's shoulder. Unbutton the victim's shirt or use the scissors from the AED unit to cut open the shirt to expose the chest. If the victim has thick chest hair, you will need to shave it with the supplied razor. Turn on the unit and follow the voice prompts. One pad will be placed on the victim's right shoulder and the other on the left side in the middle of the ribs. Pediatric pads are used on infants under 1 and have different placement. Once the AED has delivered the shock and you are instructed, immediately begin CPR with compressions. To find the proper location for your hands, use your fingers to find the bottom of the breastbone and place the palm of one hand directly above this point. Begin CPR by placing one hand on top of the other and intertwining the fingers. Straighten the arms and move the shoulders over the wrists. If your elbows are bent, there is a greater chance of rescuer fatigue, which is when the rescuer is too tired and can no longer provide care. Keeping your elbows locked and shoulders over the wrists also allows for the greatest use of your body weight. Push down on the palm of your hand in the center of the chest, approximately 2 inches for adults. Be sure to fully release after each compression. Compress the chest hard and fast 30 times at a rate of 100 to 120 times per minute. If possible, give 2 rescue breaths after every 30 compressions. To give rescue breaths, place one palm on the forehead and use your thumb and pointer finger to pinch the nose. Use the other hand to lift their chin up and open the airway. Completely cover the victim's mouth with your mouth and blow in for approximately 1 second. Do not overinflate the lungs. Remove your mouth and look to see if the victim's chest rises. Give one more rescue breath, then immediately go back to doing 30 more compressions. All of this must be done as quickly as possible so that you can get back to compressions. If the chest does not rise, tilt the head back again, make sure the nose is pinched closed, and you have a good seal with your mouth. Continue doing 30 compressions and 2 rescue breaths until help arrives. Many people are wary of doing mouth-to-mouth, especially to a stranger. There's a solution. Compressions-only CPR, also called hands-only CPR, is continuously giving forceful compressions to circulate the person's blood to their brain and heart. Do not stop to give rescue breaths or to take a break. The lungs have air and blood has oxygen. The important part is to circulate it throughout the body. Compressions-only CPR is dramatically better than doing nothing at all.